Hi, I'm Bennett, and I'm the lead product engineer on the spatial analysis and data science software development team at Esri. I've also been coordinating our analysis work in response to COVID-19.
And I'm Lynne Buie. I'm a product engineer on the spatial statistics team at Esri, and I've also been working on the development efforts for the COVID-19 Modeling Toolbox.
Now, it has been incredible to watch the way that the GIS community has really done such amazing work at every single step of the way in terms of COVID-19 response, from data collection through modeling, all the way to these operational decisions that are driving action. Now, in the modeling space, one of the things that we're seeing is that there is such incredibly responsible work being done. No one wants to take one model and kind of throw all their eggs into one basket. Instead, we're seeing that organizations want to take the best of what's out there from all of these different research organizations all over the world, take the strengths and the weaknesses of each different model and bring them together and use all of that information to make the best possible decisions.
I agree. It's been really great to see. And in the past few months, we've been working really hard here at Esri to get some of these models into the ArcGIS platform so that you can use your spatial data as inputs to these models and use the outputs to the models in your other COVID-19 modeling workflows. Now, 1 month ago, we released the COVID-19 Modeling Toolbox, which contains the CHIME model tool.
And this week, we also released a new tool, which is part of that same modeling toolbox. It's a model from CDC called COVID-19 Surge. Now, it's very similar to the CHIME model in terms of its kind of epidemiological properties. And it fits right into this workflow of bringing together multiple models to make the best decisions possible.
Yeah, and what's really special about this tool is that it allows us to really visualize what might happen when we start reopening.
Well, I think that probably the best way to understand it is just to see it. So Lynn, why don't you give us a quick tour of the new COVID-19 Surge tool?
Okay. So I have the COVID-19 Surge CDC tool open in ArcGIS Pro. I've used as inputs to the tool the county level case data for Florida, derived from the Florida Department of Health data. I've input the county population into the population parameter. This is a really important parameter because it defines how many people are susceptible to be infected to the disease within each county. The cases in 14 days before start date and total number of cases to start date parameters are also very important. Together, these two parameters define how our model is initialized. The new infections per case, or R0 parameter, is one of the most important epidemiological parameters in the model. This defines how many people each infected person will go on to infect. I also entered some hospital resource information and hospital stay information into the tool. Then I added a phased intervention plan. This intervention is most stringent for the first 2 months, then lessens for the next month, and lessens again after that. Let's have a look at the outputs to the tool. The first output is the daily estimates feature class, which has one record per day per location. One of the most interesting things we can look at in this layer is the daily hospital census projections chart. This shows us that phase 1 and phase 2 have reasonably low levels of hospitalizations. However, in phase 3, the hospitalizations start to jump severely once the lowest level of social distancing or other interventions is in place. We see that this peaks around day 130 of the model. Looking at the second output of the tool, this is the summary estimates feature class. This shows us the peak model demand, the model inputs for each location, and some overcapacity statistics. I can publish this layer alongside the same layer for another model with the same data, but different model parameters, and use these together in the ArcGIS Online Capacity Analysis Configurable app. On the right, I've included the results for the model you just saw. On the left, I ran the model again, but with a full reopening from the 1st of June instead of a phased approach. I can use the time slider to see what happens each day for each model, and I see that the peak is hit on the full reopening model around about the middle of July. Then I see that with the staged approach to reopening, the peak is hit around a month later and it's significantly lower, meaning that there's less burden to the hospital systems.
It's really powerful to be able to compare these different scenarios so that we can use them to make the most informed decisions possible. It also empowers us to share the results of this type of analysis with stakeholders and the public so that there's transparency in some of these decisions that we're making. Now, it's also really important to be able to do this kind of analysis within our GIS workflows. It means that we can improve our models using spatial data as input, and the output of those models can feed some of those operational decisions that we need to make. Things like, where do we site test facilities to make sure that we're putting them in the places that need them most? Or where do we allocate our hospital resources, and how do we move things around based on where we expect demand to be greatest?
It's been amazing to see how the GIS community has come together in this time and how you've used spatial data science to really enhance your COVID-19 modeling workflows. Thank you so much for all the hard work you've been doing.